Welcome to the WAVA Circle, real talk on fertility, wellness, and trying to conceive. I'm Gabby Paychev, founder of WAVA Health and fertility educator. This podcast is your community space for navigating the path to parenthood with evidence-based insights, authentic conversations, and genuine support. I'm dedicated to being here with you through every part of your journey. And today I'm really excited to be here with Dr. Tia, a pelvic health physical therapist, who's going to talk about how pelvic health therapy is related to fertility and how it can help those trying to conceive.
So my name is Dr. Ukpe-Wallace, but it's go by Tia, and I am a pelvic health physical therapist. I'm located in Oakland in the Bay Area, and I've been in practice for about 6 years. My journey, like how I got here, was really a lot of my own pelvic health issues. When I was in my 20s, I was dealing with chronic UTIs and bacterial infections. And then in my late 20s, I got diagnosed with fibroids. Never had any symptoms, never caused me any issues, didn't think it was going to be a problem for me to be able to conceive. Luckily, I was able to conceive, but then ended up having complications because one of the fibroids it's usually like a competition of blood supply. So the fibroid unfortunately went out of my fetus. And so I had a 20-week loss.
Oh, I'm sorry.
Yeah. And having a 20-week loss, like having a miscarriage, like that wasn't anything that anybody talked to me about. Like I was the assumption you get pregnant and it's beautiful and you have your baby at the end. And that wasn't the case. Having that loss and then having another loss and ending up having surgery to get rid of the fibroids. And then luckily I was able to conceive with my daughter, who's 10 and a half years old. But it was really a long journey of being able to really have a true understanding of what was going on with my body, why I had the fibroids in the first place, why I was struggling to conceive. And so I was teaching yoga at the time. I knew I wanted to do something more than just teach yoga. And I think, unfortunately, the loss was the catalyst to make the move towards going to grad school and becoming a physical therapist. I ended up meeting with one of my instructors who was a pelvic floor PT. And I knew that was the route I wanted to go. There's such a huge need and there's not a lot of us who are doing this work. So I'm really fortunate to be able to do it. It's the care that I wish that I had and that I had known about when I went through my losses, or just even as a 20-year-old dealing with chronic UTI and not knowing what to do other than taking antibiotics. So yeah, that's been my journey.
Something you mentioned, sometimes you don't even have the symptoms. So in those kind of situations, would you say that it's best to be preventative and talk to a pelvic health physical therapist upfront, or should you wait and see if you, let's say, try for a year, you haven't been successful? Maybe that's the time to talk to a physical therapist. When is the best time?
I think when you're already having that inclination that, yes, you want to conceive, I think it's definitely a right time. I know I will also usually see a lot of patients or clients who have been on birth control, whether it's IUD, but for a really long time, and they don't really have a good sense as to what is going on with their cycle because it's been essentially suppressed with birth control. And so they don't really have a good sense as to what is the natural ability for their body to be able to conceive. So I think like as soon as you're getting off of it, I think it can be worthwhile and helpful. I think just in general, it's important to have at least like a baseline. So just know what you're starting with. So even if you had no complications, no history of like UTIs, yeast infections, no type of trauma, no surgery, no endo, anything like that, it's still really helpful just to know where you're starting from. Because I think even if conception is not a problem, you still have to birth your baby. You still have to go through postpartum. And those are still all challenges to your pelvic floor. So might as well have a really good understanding of, okay, this is what I'm starting with. These are potentially the challenges that I might be faced with when I'm having to go through labor. I think everyone should at least, even if it's just for one visit, just to get like a really good sense as to what's going on with their bodies. So
being preventative is definitely key. And so do you want to talk more about what is really pelvic health physical therapy? I have to admit, when I was going through my infertility journey, I was struggling with frequent UTIs for a whole year. That year we were trying to conceive. And because of them, I also have pain during intercourse, but then you're trying for a baby and it's just not working. And those UTIs were not going away. They were trying different ways.
to treat them. I ended up taking antibiotics, and nobody ever told me I could talk to a pelvic health physical therapist to make them actually help me. A lot of people are not aware, and I want to raise more awareness and maybe tell me more about what it is and what are the areas or the most common conditions that could cause infertility and it can help.
Yeah. Yeah. Pelvic health physical therapy, it's really going to be addressing everything around the pelvis. So everybody poops, they pee. And if you are an adult, then you are having some level of intercourse, whether it's like solo or with partner. And so all of those functions of pooping, peeing, intercourse are pretty much present in the pelvic cavity. And so my job as a pelvic floor physical therapist is really to do an assessment of the bladder, of all of the structures that support the bladder, all the structures that support the ability to be able to have bowel movements. And then obviously all of the support structures for the uterus. So whether it's, bleeding during periods, in ensuring that yes, you're able to conceive, that yes, you have the ability, if you are pregnant, to be able to have a baby, and that then there is normal function in postpartum, and then just in your general everyday life as well too. And I'm using various tools. So as a physical therapist, I'm using my hands a lot. So I do a lot of manual therapy. I practice visceral mobilization. And so with that, viscera is our organs, and it's organs, it's fascia, it's nerves, it's any soft tissue like ligaments, it's the nervous system. And so I'm assessing and seeing like how well are those tissues moving? Because if those tissues aren't moving well, then that's going to have an impact on fertility. And so some of the common conditions that I generally see for those who are struggling is either, so like I mentioned earlier, like surgery, especially if a person has had endo, there's going to be like endometrial lesions. That's going to leave scar tissue. They go through a procedure to remove the lesions. That's going to just leave scar tissue as well. So any type of surgery is going to, C-sections. Yeah. Even hip repair, especially if you're an athlete and you had a torn labrum in your hip joint, that's a surgery. And that's going to also affect some of the pelvic floor muscles. So I'm looking at all of the soft tissue. I'm looking at the scar tissue. And then how is that also impacting the ability for the organs? Because all of like the uterus, for example, there's 6 ligaments that attach the uterus into the pelvic cavity, with 2 of them attaching to the front of the sacrum. So it's like endo lesions were on those ligaments, that's going to have an impact on the ability for the sacrum to be able to move really well, which then is going to have an impact on how you're walking, which then will have an impact whether it's like hip pain, back pain, foot pain. So generally, like if someone is experiencing any of those musculoskeletal conditions anywhere, pretty much from the spine all the way down, I would probably even say even from the jaw as well too, because like even TMJ, breathing issues like that also will present with pelvic floor issues. So anything really that is affecting, the body, I think you should be assessed. And it may not have any implication for fertility, but why not get that assessed and see how that is having an impact? So generally, it's really just if the pelvis isn't moving well, the sacrum isn't moving well, the hip joint isn't moving really well. If someone is dealing with back pain, if they've had surgery,
It's about menstrual pain.
yeah, and especially with menstrual pain, and they're having like really heavy cramping, a lot of that, I'll speak to at least like the heavy cramping is like the uterus is a muscle. So the uterus is contracting in order to be able to help to expel all that blood. But if there's something wrong physiologically that's not allowing the uterus to do the job of expelling the blood out, it's going to contract even harder, which then creates even stronger cramps as well too. So then we have to address, okay, they're having heavy cramping. So what is causing that? Why is their uterus and their body having to work extra hard in order to be able to get the blood out? So again, they could be any number of things. So again, whether it is a musculoskeletal issue, whether it's a visceral issue, whether it's something that's actually happening inside of the uterus that's not allowing movement, or it could be something on the outside of the uterus. Because it's a very tight, compact environment with all of the other organs and structures that are there. So yeah, definitely heavy bleeding, heavy cramping. If there's any irregularity with their periods, which is very common, I would like even like looking at the color of your blood as well too. It should be like a bright red. And sometimes those who are dealing with infertility are used to seeing dark chocolate blood, or it starts out around when they start to bleed at the beginning of their period. And that tells me that, okay, there's some level of stagnation because that's old blood from your previous period. It should be bright red when it starts. Or even if the period is really short or if it's really long, all of those are going to be some indications that there's something physiologically imbalanced in their body, in their pelvis, that would definitely warrant, just as they're going to their doctor, their OBGYN, gynecologist, they should also see someone to also address some of those musculoskeletal issues as well too.
Are there any common misconceptions you think we can share?
One of the things that, like I mentioned, so one of my jobs is to be able to like assess the organs. I'm assessing the pelvic floor. The only way to access it is either vaginally or rectally. And so I think when most people are told like, oh, you need to go and see a pelvic floor PT, and then they realize, oh, that's going to be one big component of it, they think that's all that there is.
Mhm.
So I think there's definitely, especially someone who's been dealing with some level of trauma, any type of abuse, anything like that, obviously is going to be like a really big thing. But then also knowing that that is not my only pathway to treat. So I'm not just going to be treating vaginally, and that's not the only thing that I'm going to be doing. I'm going to be assessing your whole entire body, like the jaw or how you're breathing, because all of that will be impacted by your pelvic floor. So how someone is carrying themselves, how they're walking, just for me to be able to assess how someone is walking or how they do a certain movement, that's going to tell me a lot. How are their hips moving? How is their pelvis moving? How is their spine moving? So I can then be able to address pelvic health conditions. It can be from a movement-based aspect. It can be from getting better mobility in your thoracic spine, or make sure that you are able to actually breathe fully, utilizing your respiratory diaphragm, which will have an impact on your pelvic floor diaphragm. So I think that's a common misconception, is that I'm just going to zero in. Yes, so much more than that.
And you said you also can use external techniques. It doesn't always have to be internal.
Absolutely.
Alimentation and the comfort level.
Definitely.
In our next episode with Dr. Tia, we'll discuss the practical side of pelvic physical therapy for fertility. We'll talk about a specific fertility program that is 6 weeks long and can be used as a standalone treatment or to prepare for a medically assisted cycle such as IUI or IVF. This program has an 83% pregnancy success rate, and it's based on a 4-year evidence-based research study that was done in September of 2012. Whether you're preparing for pregnancy or experiencing fertility challenges, this program is a safe, gentle, external pelvic visceral manipulation technique designed to restore the health and well-being of the pelvis by addressing scar tissue, adhesions, malalignment, or decreased mobility of the pelvic and reproductive structures. Again, it has an 83% pregnancy success rate. Make sure to subscribe so you don't miss our next episode. Until next time, this is Gabby Paychev with the Wova Circle. Thank you for listening.